Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. Excited to bring you another in our series of interviews with health IT thought leaders. And today is a good friend of mine for a long time. You probably know her on social media. You may have seen her across all of the media, but she's Dr. Geeta Nayyar. She's executive medical director and general manager of healthcare and life sciences at Salesforce. Welcome, Dr. G.
Thanks so much for having me, John. Good to see you.
Yeah, I mean, it's sad. It's been like a year and a half. We hang out at a conference every other month or so. So it's so sad, you know?
Very sad that we can't compare our foot gear and and our design and
Yeah,
functionality, but
yeah.
really terrific to see you.
Dr. G is well known for her foot gear. I guess Zoom doesn't facilitate that. So
I'll send you
anyway,
some pictures. I'll send you some pictures. Although they're like the best, just flip flops. It's the best thing ever.
it's true. It's amazing how many things have changed. Well, for those that don't know you, tell us a little bit about yourself and also Salesforce work in healthcare.
Sure. So currently I'm the general manager and vice president of our healthcare and life sciences business. I'm also the executive medical director and a practicing rheumatologist at the University of Miami. It's been really interesting times to be on the front lines of the pandemic, as well as building products for the front lines. I'm really proud of the work that we're doing here at Salesforce. We're moving the needle every day on patient engagement and really trying to connect patients and doctors in a way that's never been done before.
Yeah, well, Salesforce does so much in healthcare. And this month on Healthcare IT Today, we're focusing on the cloud. And I thought Salesforce is the perfect one for this because Salesforce is known for your cloud solution. In fact, you literally have a cloud as your logo, which I think is how much depth there is to this topic, right? But what does it really mean for a healthcare organization, for them to work with someone like Salesforce and use your cloud solution?
Sure. Well, first of all, thanks for noticing the cloud, right? I think that was very intentional on our
Yeah.
part. But really what that means is that we're trying to solve really clinically relevant problems, right? More so today than ever before as we think about where we are in the stage of the pandemic. So connecting patients and doctors, connecting payers and patients and doctors, right? It's all the different stakeholders in healthcare that we know are disconnected, that we know drive inefficiencies in the system. And we really want to be the great connector of that. But really, we are the system of engagement, whether you are a payer or a provider. And at the end of the day, we know that the consumer is the patient. And look, the patient's at home, just like you and me, John, right? They may not even be wearing shoes, right? So they're online looking for their doctor, looking for information. They are looking for someone to engage with them on their healthcare, which is top of mind for everyone today. And that is really what the cloud is enabling our customers to do.
Yeah, and it seems like it was really relevant in this last year as many healthcare organizations had to scale up quickly. I think that's one of the beauties of the cloud, right? Is that, the idea of scaling to a huge population for Salesforce is like it's not even a question. It's just like, oh yeah, of course, no problem. Whereas if it was an on-premise thing, that's a harder thing to do. Did you have that experience with some of your customers throughout COVID?
Sure. So, wow, John, you said it better than me. You should come and join our team. But
Are you
for
hiring?
sure, always for good people
Yeah.
like you. Listen, it really was, right? Before the pandemic was a different time. A lot of folks thought of a system of engagement as kind of a nice to have, not necessarily a must have. Many folks felt very comfortable with their current legacy systems, the EHR obviously being one of them. And overnight that changed in March of 2020, right? We had hospital systems calling us, many inbound inquiries, saying, gosh, we were just incubating this. We had just kind of tipped our toes in this, but we want to scale. We
Yeah.
want to partner with Salesforce. We want to scale. We have to do this, and we have to do this for our entire population, and we need to do it now. And what we've seen is the evolution of that. And what we've also seen is people that were putting band-aids on things, right, have realized that, now we got to have a strategy. The band-aid's not going to cut it, right? What's the transplant? What's the transplant look like in
Yeah.
our hospital system or in our payer system so that we can actually scale that? And really, more than ever, right, we see the inefficiencies, we see the broken parts of healthcare more than ever with COVID-19. And this is a big part of that solution, whether there's a pandemic or there's not, right? This fractured system has been around, unfortunately, since the beginning of our careers. And I for one am really proud to say that I think we are very much part of the solution and moving the puck forward.
What a great analogy, a Band-Aid versus a transplant. That is beautiful. I think that's where we're at, right? In dealing with this. What are some of the, kind of advantages and disadvantages you saw with, going to a cloud solution during COVID? It's interesting you mentioned the ability to connect all of these disparate sources. Is cloud like an advantage for that or a disadvantage? Like, how do you see that? And what other advantages and disadvantages do you see?
Sure. So, I think that's a great question. And with any decision, certainly in medicine, we always do a risk benefit, right? We weigh the risks and the benefits. The cloud benefits outweigh the risk by far, right? Everything that we've talked about, being the system of engagement, connecting those that haven't been connected, driving informed decisions, a complete view of the patient, cradle to grave, right? Behind the scenes, in front of the scenes, if you're a payer, trying to connect all the dots on enrollment, membership, benefits, all of it can be done within the cloud. Right. The disadvantages, I think, are also pretty obvious in that there are many broken parts of the healthcare system. We're not a silver bullet. I wish there was a silver bullet. There is no such thing. But when we think about clinical and operations, driving those efficiencies, I think that's the biggest advantage to the cloud. And anything new is hard, right? Anything new is hard. When we rolled out the EHRs, that was hard. It's still hard. And so, those are the things that you have to kind of put on the table when you're deciding the risks and the benefits. But I think the benefits are pretty obvious.
Yeah. It's like you said, it's hard. It's still work, right? Like there's no silver bullet that just says, oh, I implemented this and yeah, my life's easy. I mean, it takes planning, it takes leadership. That's interesting. That's a really great point.
And it's culture, right? So the people part in many organizations is the hardest part, right? The technology's there. We've got the technology. We've got an amazing system of engagement. But you also just as an organization have to have that sheer will and leadership and cultural fit, which is really the hardest part, right? And I think COVID's pushed that too, right? COVID's pushed that employee safety, employee wellness, physician burnout, patients are first. I think they've pushed that cultural shift even further for every organization.
Yeah. So do you still hear from a lot of customers? I know I heard this a number of years ago, that they don't want a cloud solution, that they really want it in-house or on-premise. Do you have those conversations and hear people asking it? Or are they finally just like, okay, it's cloud and I'm in?
Sure. The appetite for innovation has completely flipped overnight, right? The entire appetite, the entire conversation has switched overnight, John, right? This is not your grandmother's healthcare system, right? This is the healthcare system of a new generation that will always know a pandemic and will always be interested in thinking about their health. My daughter washes her hands more than anyone I have ever seen, and I'm pretty sure she's going to do it for a lifetime, right? So this is a whole different environment. The appetite, the thirst for innovation, the thirst for creative solutions, and someone who really knows customer relationship management. I mean, that is Salesforce sweet spot. And never before has healthcare needed and wanted and asked for this kind of solution or technology the way they are now. So for us, we are having awesome conversations that continue to lead to creative solutions because there's so many different things that you can do with our platform. So I'm just really excited to see that we continue to move the envelope forward.
Yeah. It's interesting you say it's not your grandma's healthcare system. I was just picturing my grandfather going around selling radiology systems, door to door. It's like, I mean, how do we, we're in an interesting time though, where there's all these innovations happening. And how does a healthcare organization find that innovation and know that's the right one? It's almost like there's so much noise now and so much access to information that it's overwhelming. So it's almost the opposite problem of previously, where you'd get the door-to-door salesman coming in telling you about innovation. Now it's all there, but it's too much. Like what would be your suggestion to an innovation person, whether it's CIO, CMIO at a healthcare organization, and how they should approach their innovation efforts?
Sure. I mean, those are really the conversations I'm having every day with customers, right, John? And the first thing is to assess the current broken infrastructure, right? Because chances are they're having a conversation with us because something's not working. Yeah. So wherever the legacy systems that they were relying on and trusting on, to get them through this pandemic, there's been a failure, right? So a lot of it has been, where is the roof leaking, right? Is it the front of the roof, the back of the roof, the side? What can we do in the short term and what can we do in the long term, right? So we saw at the beginning of the pandemic, a lot of folks saying, we just need to, this one patch on the roof, and then the storm is going to blow over, and then we're going to be fine, right? And then the other back of the roof, popped, and the other hole popped, and things just kept breaking, right? So then the conversation went from, okay, how do we go from being tactical to strategic? And how do we be predictive and really commit to the fact that this isn't going away, right? Whether it's COVID today and it's chronic care tomorrow, all of these issues in healthcare have been exposed in this way that hospital systems are saying, we've got to get strategic, no more point solutions. And the advantage of a new infrastructure, right? Not that we're throwing out the old infrastructure, it's there, it's necessary, it's keeping the roof together. But how do you now complement the existing infrastructure in a way that it bolsters it, augments it, and is prepared for the next crisis, whatever that might be, right? A busy night in the ER, another pandemic, or whatever, none of us can tell the future. And that's where a platform like Salesforce does really well, because we are able to get strategic with hospital systems, payers, and mold to whatever the dynamic nature of the situation might be, right? Whether it's patient engagement today, physician engagement tomorrow, membership, enrollment, benefits administration. Those are the things that hospital systems are realizing that they need to be more agile, right? It's not just about today's storm. It's how do you make sure that your roof and your house and the foundation and everything is strong enough to weather whatever's coming. And I think that's the biggest change in the conversation, is this isn't temporary. We now need a long-term solution, just like our EHR investments, our ERP investments. Investing in a CRM platform offers the same thing, that we can pivot, be agile, and really solve the problems as they're coming, rather than being reactionary and just putting buckets under the roof to collect water, right?
Yeah. Another great analogy. So
I had a earthquake during the pandemic. In case you can't tell, we had a hurricane, terrible tropical storm, and so I went through this. So I can say this with complete credibility.
What a great example. Lived experience is always best. So let's talk about some specific examples. Like, how is Salesforce Cloud Solutions for Healthcare really helping an organization? What are some examples of how it's helped? I mean, I think the ones that are interesting to me is the ability to connect with patients at scale, which, for some reason, we didn't build that before, right? I like to say we kind of took it for granted, right? That we didn't need to, because the patients just kept coming. So how can Salesforce help a healthcare organization?
You got it. So, it's first of all, it's about a personalized experience, and then one that is complete, right? So again, that 360 view, and then one that does scale. So whether it's John Lynn or it's John Lynn's entire family or John Lynn's entire zip code, right? So knowing that you are a 25-year-old Caucasian male that lives in Vegas, loves Dr. G's shoes, often shops online, to try and compete every hymn, right? It's anticipating things like that and saying, gosh, John, we noticed your birthday's coming up, and you're going to turn 50, and hey, here's some information about a colonoscopy, and hey, Dr. G hasn't seen you in a bit, we'd like to hear from you. This is how you make an appointment. Call our contact center, right? And then when you call the contact center, they actually know who you are. Like, hey, John, how are you? How have you been?
Yeah.
Right? We haven't heard from you in 2 years. What's going on? Did your insurance change? Was it COVID? Let's go ahead and get you in for that appointment, but let's do your lab work beforehand, because that's going to be more efficient, right? And let's make sure you do know about COVID protocols before you get there. And then when you get there, making sure that you are able to have access to that information, your doctor has access to it, and whether it's making the appointment faster or easier, or saying, hey, John, if you can't make it, we noticed you canceled your appointment, let's do a virtual visit. Let's just hop on a virtual chat, a virtual video, have the visit, and really intelligently kind of walk through that journey with you, but also predictably, and also in a way that, John, keeps you out of the hospital, right? Because if you've done that and you've seen your doctor and you're getting that regular cadence, you know what's going on, your doctor knows what's going on, that information is going with you. We're able to see your entire journey for as long as you are on our system, right? Which we hope is cradle to grave. And that changes the game, because now you've actually driven outcomes. You've driven that patient from avoiding a hospital admission, avoiding a stroke, right? Avoiding things that are irreversible, frankly, right? So there's no better experience than one that is personalized, memorable, but also just has less friction. right? It's rare that a patient ever says that people jump up and down and say, I had this amazing experience at my hospital, right? So we want that. We want that for our hospitals, and we want that for our payers, because a lot of the angst on the payer side drives the front end, right? So we don't know your insurance. We don't know what you're covered for. How are we also driving that experience and making sure that you know what your bill is going to be like and how do you pay it efficiently? And so it's that whole view, so that docs like me get to just practice medicine and not have to worry about all of that jazz. And you, John, can just focus on the visit and not be worried about, am I ever going to get that appointment? Is someone going to call me back with those results? Which are scenarios we all experience, too frequently in the system today.
Yeah, and I love how you described the integrated experience. Personalized is amazing, but I love it that it's integrated across the form I fill out, the phone call I make when I see the doctor. That all the information's integrated, I think is powerful. Although if it says I'm 25 years old, I really like that data. That sounds like quality data.
Mine says 21, so just saying. My birthday next week.
I would have said 20, so I guess I was off, but no, but it is important.
Well, it is, and I'll tell you, one of the other things is when we think about system of engagement, it's there's sophisticated things that we can do, but there's also some really simple things that hospital systems are really not thinking about. Patients are looking for information, right? And there's so much misinformation, disinformation that are actually impacting people's lives. They're impacting our lives as a community. We're realizing that. And the problem that we're finding is that patients want to come to their hospital. They want to read the blog from me. They want to get the content, the video from their doctor, their hospital. But if their hospital doesn't have that, if that's not part of their system of engagement, it's a missed opportunity, because then that patient is either going to go to CVS, Walmart, the competitor down the street, or somebody else on social media or some other place that is not the correct source. And then that propagates all of this disinformation, and we've seen the ramifications of that, right? But the truth is, patients still trust their doctor, but getting access to their doctor is hard, right? No doctor is available 24/7, 365 days a year. So that's also where our platform comes in. And to your question earlier, the chief marketing officer and the chief medical officer, they need to be best friends right now, because that is how you actually retain and acquire patients, because they are looking for the information. The thirst for information right now is like we've never seen it. Health literacy, I have never seen so many patients either misinformed or informed in my career. I mean, I just saw a gentleman last week that came in on like 25 herbals and 5 energy drinks, and he was a 35-year-old, very healthy gentleman. And I just asked him, who put you on all this and why are you taking all this? And he said, oh, well, doc, I just wanted to be healthy. I'm trying everything I can to not get COVID. And this is what I read online. I read that if I take a little bit of mustard seed and a little bit of ginger and a little bit of turmeric and a little bit of Red Bull and a little bit of and I said, well, you've blown out your liver, you've elevated blood pressures, and all of this was avoidable. It's all from all this jazz that you read about online. And how neat would it have been if I could have just said to him, hey, here's the digital journey I want you to be on. This is our hospital's, protocol. This is all directly from me, my office, my colleagues. When you have a question, come to us, ask us. And when you need to come in to see us, it's as simple as a click, right? Yeah. And that's the missed opportunity, because there's only, a few hospital systems that you Google that have that presence, right? And we all know them, right? Mayo Clinic, Cleveland Clinic, Harvard. But the average hospital system, that MarkCom investment was never as top of mind as it is now. And that's part of that system of engagement piece, that marketing piece, but the depth with that clinical part. And so it's a whole new conversation. It's a whole new world, but patients are listening and looking for that. So if you do that, you've differentiated your business, right? And the ROI pays it forward in terms of outcomes, in terms of patient retention, acquisition, trust. Trust is the biggest thing right now, and hands down, we've seen that patients still trust their doctor. So it's about giving that doctor their voice, but in this way that is very tangible and accessible to that patient, and that they're speaking to John, right? You're not interested in information about an 85-year-old male's health issues, right? You need that younger than 25 demographic, right? You need to know what you need to do at your stage of life. And so that's the name of the game right now.
Absolutely. My friend, Sunny Terra, who's the founder of Care Cognetics, wrote an interesting article on our site. And he said, that the care manager may become the most influential person in healthcare, even more so than the doctor. And it was interesting. A doctor that advises them, he said, "Hey, can I argue for the doctor?" And I said, "Sure, that's great." And interestingly enough, he said, he pointed out what you just said, which is, hey, the care manager has an increase in influence, and he doesn't disagree with that point, right? And it's not that the doctor's decreasing in influence, but he said that care manager still needs the doctor to create the care plan, just as you described, right? So it is a team sport that requires both the doctor providing the high quality information that the patient trusts, and together with sources, whether it's the website, whether it's a care manager, but it's that marketing piece, right? That says, how do I make sure that you're following the care plan that Dr. G put out for me, right? That I trust, but maybe I forgot or I didn't understand. So, it is interesting. And the divide between the CMO and the marketing person is huge right now. How do we even bridge that divide? I mean, is it about having the right platform and changing the discussion, or what do you think it takes to bridge?
Sure. I think the first thing is understanding the problem, right? So the hospital systems that are smart and savvy right now are really, like I said, first assessing where the holes in the roof are, right? And then who can help repair that roof? What is it going to take? And is it the role of the CMO, the other CMO, IT? But I think it's exactly what you said, which is that it's a team sport. It's a cross collaborative effort. And there's no doubt that, we're all still learning as we go as far as where the pandemic is and what the future is going to look like. But it's always been a team sport. And it's also about putting more tools in the hands of the frontline staff, right? So to your point on the care plan, I want to be able to add digital engagement journeys, patient engagement journeys, care coordination journeys. How are you as a hospital system not just giving your doc the CT and MRI as their only only tools to prescribe, right? There's now this whole other element to acknowledging that clinically what is so important. And I think that's the biggest change. And I think we're seeing it on the payer side too, right? There's an acknowledgement of, these inefficiencies have to go away because it's expensive. It's expensive, right? It hurts the payer business, it hurts the provider business, and ultimately it hurts the patient. So all of those things, and again, I do think, for whatever it's worth, one of the pluses that have come out of the pandemic is that we have really, really seen where healthcare has broken down, and now there's so much more space and appetite for innovation. We're seeing that at Salesforce, and I think we're just seeing that, in the industry across the board, that the folks are really hungry for some creative and innovative solutions, and we finally have the opportunity to also get reimbursed for those. So I anticipate that we'll continue to invest and grow as an industry.
Well, change is afoot. Dr. G, this was awesome. I always enjoy talking to you and hearing these perspectives. Thanks so much for sharing them.
Likewise, John. I really like your shirt. I'm glad we were able to match our colors today. Maybe next time we'll do blue or something.
Yeah, well, hopefully next time is in person and we can share our shoes as well. So
I would love that. I don't know about sharing my shoes, but I would love to see you.
well, not share. I mean, with our audience, but yeah, I don't think we're the same style. Thanks so much, Dr. G. Appreciate everyone. And thanks everyone for watching. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Dr. G.
Thanks, Sean.